Gastroesophageal reflux. This is a condition in which gastric contents enter the esophagus with a pathological opening of the cardiac opening. Today, about 1/4 of the world's population has gastroesophageal reflux. According to World Health Organization, European statistics, about 30 to 35% of the total number seek medical help from specialists. 3 to 4% receive full-fledged treatment. Anatomical features: disorders of the muscle tone of the lower esophageal sphincter, congenital and acquired destructive pathologies of the esophagus, herniated diaphragm, and failure of connective tissues. Symptoms of gastroesophageal reflux. Symptoms of GERD are divided into esophageal and extraesophageal. Esophageal ones are heartburn, especially at night and in the morning, excessive drooling, belching of air, sour and bitter taste, nausea and vomiting, sore throat when swallowing, aching back pain, epigastric regions. Extraesophageal symptoms are pain in the throat, neck, cardiac arrhythmias, inflammatory disease of the oral cavity, damage to tooth enamel, caries, dry unproductive cough, etc. Diagnostics: general clinical analysis of blood and urine, fecal analysis for caprogram, biochemical blood test, chest radiography, radiography of the esophagus, ultrasound examination of the system. Next, treatment of GERD. The main treatment for uncompleted GERD consists of a healthy lifestyle and nutrition. With inflammatory processes in the esophagus in the form of reflux esophagitis, it is necessary the use of medical treatment. It's recommended to start treatment at the first signs of inflammation of the esophagus and the stomach. Esophagus at children, etiology. The leading symptom of phyllospasm is vomiting, which appears from the first days after the birth of a child. Vomiting is frequent, not plentiful, occurs immediately after feeding, 10-30 minutes after it. The diagnosis of it is based on data from a carefully collected medical history in clinic. X-ray examinations are important in the diagnosis. Treatment: maximum child exposure to the fresh air. Feed your child according to the free feeding requirement. The following mixtures has a good effect. Etiology of piliostenosis for children. Currently, most pediatricians and pediatric surgeons consider it as a congenital thickening of the pyloric muscle layer and the spasm as an independent disease based on pyloric spasm. Pathogenesis: due to the fact that a small amount of liquid food enters the intestines and its absorption in the stomach is insignificant, and with vomiting the loss is greater, a state of relative dehydration occurs. The metabolism is disturbed. Here you can see the main symptoms of it. Weight decrease rapidly from the first days. Constipation is noted. The color of feces is normal or dark green. A constant symptom of it is a decrease in the number of urinations and the amount of urine. Diagnosis: X-ray examination with a contrast mass of barium sulfate, where there is a slow flow of barium in the duodenum. Here you can see the differential diagnosis of pylorospasm and pylorostenosis. treatment in currently the generally accepted method of treating patients with this disease is surgical treatment. Thanks for your attention.